introductions, we're going to go over the RPG member roles. Then we are going to discuss some of our current priority projects, and after that we're going to get into Q&A. So with our RPG member roles, we're going to have Mary presenting to us, and our current priority projects, we're going to split that up among a lot of staff. We're going to talk about the point-in-time coordination, and Lhc Marsh is going to present on that. The VI SPDAT with veterans that we're doing in conjunction with the PIT in a few selected communities will be discussed by Sophia Cheka, and we'll get back to the housing inventory where Lindsay will present on that. I will, and I need to introduce myself, my name is Eric Samuels. I will discuss our annual homelessness assessment report, the status of that, and the likelihood of us submitting our shells for that, and I'll explain what shells means. The SSVF, which is Supportive Services for Veterans Families program, will be given an update, and the Ending Veteran Homelessness project will be updated by Caitlin Bear and Sophia Cheka. And then we will get into our consolidated application, summarize that 2015 competition, and that will be a combination of a few folks. I think Mary will be taking the lead on that discussion. Then we have the Provider Connect workshop, which Cameron Fowler will be presenting on. Sorry, we have two KFs here, and I was trying to determine who the initials were. Sorry, the two KFs, Cameron Fowler and Craig Fierro. And then we'll talk about the plans for the 2016 project year, and Cameron will discuss that. So we have a pretty full agenda. We realize that some of you will need to duck out a little early, or you may have your attention diverted, but never fear. These webinars are always recorded and put up on our website, so if you need to view them at a later date, you can. And we will be sending you handouts and notes after the meeting. Some of those handouts will be placed in your GoToMeeting toolbar, and you can access those while we're meeting. So take advantage of those handouts, and also use your toolbar to write questions in. We have all of you on mute because we get a lot of feedback. So write questions in, and if you need to ask a question through your mic or telephone, either write in and say, please unmute me, or raise your hand using the GoToWebinar tool, and we'll know to unmute you so you can ask a question. So like I said earlier, we have a lot of people joining us in-house and outside of the office. I'm just going to go through and identify the people that are in the room. I'm not going to ask them to introduce themselves right now. You'll hear them when they present. So again, Eric Samuels. This is probably one of my last webinars I'm leading. We'll see. I'm here, and to my left, Sophia Cheka, our Systems Change Coordinator. Then we have Lhc Marsh, our Data Coordinator, joining us. Mary Dodson, our COC Manager. Craig Fierro, who's running the ship and taking your questions, is here too. And then Caitlin Bear, our Program Coordinator. We have a lot of people here. It's hard for me to keep up with titles. And then finally, Cameron Fowler, our Director of Continuum of Care Programs. So we have a big group here in the office. And then from around the state, we have, well, it looks like about 27 people joining us now. When we looked at those who registered, sorry, let me get this up. When we looked at those who registered, we had folks from all around the state register to join us, and this isn't coming across real good here, but you can see that we have a good representation. We have a lot of folks in the valley, all the way up to Lubbock, and east over to Beaumont, and up northeast in Texarkana and Mount Pleasant. So thank you all for joining us on this call. So I'm going to go ahead and get to the first item on our agenda, and that is going to be a discussion on the roles of all of you, what your roles are with this representative planning group. And I'm going to hand the mic over to Mary.
Hello everyone, this is Mary Johnson. Again, I'm the COC manager, and I'm going to be talking to you a little bit about the RPG roles. First of all, this is the first time that we are having a separate meeting of the Representative Planning Group, or RPG. That is separate from the board meeting, and it's in some ways taken the place of our prior board meetings, where the board meetings had been the ones where every COC member, and really anyone who's interested in participating, can join the meeting and hear what we're doing in our COC. And all of that kind of work will now be done at these meetings, the RPG meetings, and the COC board will meet separately, and they're focusing more on policy decisions, strategic planning, and that sort of thing. So this is an opportunity for where everyone can give their input, not only RPG members, but RPG members will play a special role in this, so we wanted to go through that with you all. Okay, so we start everything with what we are doing here in terms of governance with our COC's governance charter, which if you've been listening in on our meetings over the past few months, you know that we approved this charter earlier this year. Basically identifies the governance structure of the COC regarding the authority, decision-making, and accountability, so that it's all written down and transparent and people understand how the work of the COC is getting done. Again, outlines organizational structure and describes roles and responsibilities. And here is our org structure for the COC. You'll see the largest group on top there is our COC general membership. And that is anyone who works or lives in the COC. The COC board is 11 members who were elected in October. And the representative planning group, those of you who are RPG representatives, I drew an arrow next to your box where you fit into the org structure. And in short, you are representing your local homeless coalition from within the COC. You'll see the other pieces of the org structure are THN. We play a kind of a dual role here as collaborative applicant or COC lead and HMIS lead. And then the RPG can have committees to help conduct the work. So that's our governance structure. Local homeless coalitions, or LHCs as we call them, those are the groups in the local level that strategically plan and deliver homeless services, housing, and other kinds of supportive services in the communities. So in large part, that's all of you. LHCs typically have broad membership that includes a variety of stakeholders, and LHCs implement strategies, best practices, COC policies and procedures, and written standards. So in a way, they kind of operate as a mini COC lead agency for their coverage area, just like THN does for the entire Balance of State COC. The COC board earlier this year approved some LHC requirements, and those have to do with meetings, planning, RPG membership, data, point-in-time count, and housing inventory, and coordinated access. And RPG members, you see, as part of that, every LHC that meets the minimum requirements is allowed to select a representative to the RPG that officially represents their coalition. And you can see more about those requirements on our website, or contact me if it's easier. That you could welcome to do that too. And we're aiming to have all LHCs meet the requirements by August 31st of next year. So if you don't have an RPG representative yet, or you're not meeting at least quarterly, or in some other kind of way you're not meeting one of the requirements yet, in this first year, that's okay. We are going to help you do that hopefully by the end of August. Here's a map of our local homeless coalitions. Right now we've got 26, and they're all color-coded there, and you'll see cover a large portion of the COC, but not every portion. So if your county or your agency's coverage area does not currently have a local homeless coalition and you'd like to learn more about creating one, let us know. All right, so the RPG, again, represents local communities and their local homeless coalition in the COC's work. Each LHC may have up to 2 representatives. One if that person is not currently or formerly homeless, but if the person is currently or formerly homeless, then sort of as a reward to the LHC, you get to have a second representative on the RPG. So we certainly want to do whatever we can do to get the voices of people who have lived experience onto the RPG. And that's one way that we're doing that. I know this is very tiny, but just wanted to show not necessarily the names of the LHCs, but how each of them has one representative that goes directly and makes up the body of the RPG. Selection process, I won't spend a lot of time on this because about half of our LHCs have in fact selected an RPG member, and I wrote to all of the local homeless coalition chair people yesterday. So if I have not followed up with you one-on-one, I will be doing that in the next few days. Or you're welcome to respond to my email and let me know where your coalition stands. Again, we want to have every LHC meet the requirements by August. And if you do that, then your LHC will be eligible to select up to 2 representatives for the following year. So this is an important year for us as we're building our new governance structure, which you're going to help us do, so that by the time August 31st comes, you'll be in a good position to have representatives for the following year. Basically, the RPG is the lead work group responsible for managing community planning, coordination, and evaluation to ensure that the system of homeless services and housing rapidly ends people's homelessness permanently. And this includes planning for the use of the HUD Hearth COC resources and coordinating these funds with other resources in the COC. So that's directly from our governance charter, and that is the description of the RPG. So RPG activities. RPG will meet monthly. That is this meeting again. Anyone in the COC, or honestly anyone at all who's interested in participating in the meetings, is welcome to do so. Meetings will include discussion of topics pertinent to the COC's work. The RPG will propose items for the COC board's approval and vote. And the RPG may establish committees. So right now it's pretty skeletal structure. We will be fleshing that out with you over the course of the next couple of months as our COC work plan comes together and as you all identify what your LHCs need, and we talk about how to accomplish the COC requirements. For those of you on the call who are RPG members or who are LHC chairs that will be selecting an RPG member with your LHC, pretty some basic responsibilities for the members: that they will participate in RPG meetings. The representatives will serve as a liaison between the local homeless coalition and the COC, ensuring information flow and consistent planning going in both directions. And then RPG representatives will submit LHC meeting minutes and list of attendees to THN. And I know some of your local homeless coalitions have been doing that already, but we would really like all of you to start doing that because that will help us better understand what are the important topics that you're discussing in your local homeless coalition meetings and how that informs the work of the COC. There's also an option that RPG members can serve on the Continuum of Care board. I'm not going to go through this quickly. If you're an RPG member and you are interested in serving on the COC board, it would basically be an additional responsibility, but that is the overall official decision-making group that acts on behalf of the COC. And you'll see seats 1 through 5 on the board are specifically designated to be filled by an RPG member. And currently only seats 3 and 5 are filled. So we do have vacancies on seats 1, 2, and 4. If you're interested, if you're an RPG member and you're interested in running for seats 1, 2, or 4, please let me know. Let me skip to what will be happening next with the RPG. Again, you represent your LHCs, but we don't want the RPG to be only RPG members. So any COC member whose geographic area doesn't have a local homeless coalition, you may still participate in these RPG meetings and on any committees. We certainly don't want to exclude you simply because you don't have an LHC or you're not officially represented by an RPG member. THN staff will provide support, and then other logistics about our work, such as voting, proposing agenda items, forwarding items for approval to the board, will be developed by us as the year goes on. And all of our work will be guided by the requirements that the COC needs to meet as a COC, as mandated by the COC interim rule from HUD, and by what the LHCs need from the COC and what the COC needs from the LHCs. Some specific activities you're probably already involved in: ensuring that COC program-funded projects and ESG program-funded projects are engaged with your local homeless coalition, reviewing data on project performance, conducting a point-in-time count on January 21st, ending veteran homelessness, and using coordinated entry. And you'll hear a lot more about those topics today during the meeting, and we will be working with you to plan all those out again over the next few weeks and months. And lastly, we want to make sure that we're hearing from you about what would be most helpful for you as an RPG member or as a COC member. Some ideas that we had: a presentation on COC basics, technical assistance on coalition building, training on best practices in service delivery, such as housing first, low barrier projects, rapid rehousing, and permanent supportive housing, training on analyzing data, and any other ways that we can all work together to make sure we're making our COC not only meet the requirements, but be very successful. All right, and if you have any questions or suggestions, or you want to tell me where you are in your RPG selection, there's my email and phone number.
Thank you very much.
Thank you very much, Mary.
And before we
go to the next agenda item,
following
along with what Mary was talking about, we want to find out how we can best help you. So we have a poll question that we want to launch, and we'll ask you to complete that, and then we will move on. So we'll give you about 1 minute to give us your thoughts on this potential presentation. So go ahead and vote.
Okay,
it looks like a little over half of you have voted, so you have a few more
muted
seconds to log your vote. Okay. We're going to go ahead and, well, I was going to cut the poll off, but people keep voting, so that's good. We'll cut it off in 5 seconds. All right, well, thank you very much, everyone. We had over 80% vote that they would like to have us do a presentation on the COC basics. So we will get that together and get that out to you. Okay. Okay, so we're going to go ahead and get to the next agenda item, which is has a lot of different sub-items. It's the Continuum of Care current priority projects. So to start that off, we're going to hand it off to Lindsay Marsh to talk about the point in time coordination. So once we get her mic down there, I'll unmute her and she can give a presentation on that.
Unmuted.
Go ahead, Lindsay.
Hey everyone, this is Lindsay. I am going to talk to you briefly about the point-in-time coordination. Everyone at this point should have already received the final copy of the survey tool and some infographic on how to do data entry, as well as the SurveyMonkey link to do your data entry. If you haven't, you need to contact me as soon as possible so we can get that out to you. Our Spanish surveys should be to you, I want to say, by January 4th, mainly because I'll be out of the office starting tomorrow and won't be back till after the first of the year. So we'll have the Spanish surveys to you early January. For those of you who haven't been involved in the point in time before, it's required by HUD, but that's not the only reason we do this. It's really good to get a comprehensive and accurate count. It really does give your community a good baseline to set goals for ending veteran homelessness, reducing chronic homelessness, reducing family homelessness, and reducing the length of time that a person or family is homeless, and as well as returns to homelessness. It's really good to have reliable data for your funders and your stakeholders, and it really does give you a peek into your community. So please, if you haven't participated, if your community hasn't participated in the point in time before, now would be a really good time to do that. We have our general point in time, which to you is just going to be a point in time, and we have 4 communities who are going to be doing a more youth-focused point in time. They have a bit of a longer survey instrument, and they're basically what they're doing is just trying to get a better understanding of the youth that are literally homeless, and this all sprang from legislation that was passed this past legislative session on doing a study of youth homelessness. So we're really interested to see how that comes out. And some of you will be doing a VI SPDAT, which is the veteran homelessness. So Sophia is going to jump in really quick to talk about that, and then I'll be right back to talk about your housing inventory.
Hi, everybody. Sit down. So I'm Sophia. I'm the Systems Change Coordinator for THN. And for the last 2 years, I've been working on implementing coordinated entry in 7 communities in the Texas Balance of State Continuum of Care. And we've done a lot of debriefing on the process. We've looked at a lot of the data. We've talked to a lot of communities, and while we've made some progress with coordinated entry, I think the deep systems change goal of coordinated entry is not happening in a lot of our communities. And so we have decided to focus on ending veteran homelessness for 2016. And part of that process is doing the VI SPDAT or the FVI SPDAT, the first one being for single individuals and the FVI SPDAT being for families with veterans in 6 communities. Can somebody pull the map up if you haven't? Sorry. And you, Sorry. So we're doing them with 6 communities. The assessment tool will only be done with veterans, and the goal of it is to get a more comprehensive, the URL that I sent you. The idea is to get more comprehensive understanding of the needs that veterans have, as well as being able to prioritize them for services throughout communities. So that's the gist. If you have any questions. And the goal is, by getting all of this information and by prioritizing veterans, we'll be working more on creating systems change in communities with the goal of impacting the overall system, so that we can create a system that prevents homelessness in the future, and should anybody end up homeless, we're able to rapidly rehouse them.
Great, thanks, Sophia. This is Lindsay again. I'm going to briefly talk to you about the housing inventory. Every year, we have to update the housing inventory with HUD, and it doesn't just mean those housing projects that are using HMIS. This is any housing project that falls within the realm of the Texas Balance of State. So what we're doing is we are going to be sending out surveys to everyone, and there are going to be different surveys for different housing types, and we will need you to fill them out. Let us know how many beds you have. Let us know how many units you have. Let us know if you have any dedicated veteran beds, chronically homeless beds, and then how many people were staying with you the night of January 21st, 2016. So those will be going out on January 22nd. So please look at those. Please fill them out. For anyone who doesn't fill them out, that actually does put a little bit of the burden on THN, because we then have to make spreadsheets and have to get a lot of staff involved to call and check on your numbers. So please pass it along to everyone you know that we will be sending out these surveys, and it would be very, very helpful to get them back as soon as possible.
Muted.
All right, thank you, Lindsay and Sophia. I'm going to give a quick update about the annual homelessness assessment report. So let me get the screen back to me. Okay, so here, of course, since it has annual in the title, every year we have to do a report to HUD about homelessness, and that report is always due around this time of year. It's not the greatest time of year to be doing this, but it is the time we have to do it. And we rely on your data and the data you put into HMIS to produce this report, and the quality of that data allows us to submit what HUD calls shells of the report, and I'm going to get into a little bit of a background on what the AHR is so you know what I'm talking about, and then I'll give you an update of where we are this year. And if I can just bear with me, we're having some technology issues. Okay, that should open up. Okay, I'm just going to have to go through the slides when it's small like this here. I am sorry. Yes, it is in your handouts. Oh, there we go. I've got better control of it now. This also is in your handouts, so you can pull it up and view it on your computer. There's a little update on the AHR. So like I said, this is a report to well, to HUD is who we send it to, but it is to the U.S. Congress, and it is a report on the extended nature of homelessness in the United States. So whenever you see HUD put out these estimates of homelessness, and they say something like homelessness is decreased by 15% or family homelessness is up, what they're using are these numbers. And they don't use every report that is sent in. Whenever they are looking at this number nationally, or they're looking at this data nationally, they take representative samples. So they use 102 different community development block grant jurisdictions by large city size, medium city, and small city, and that's what they use to produce their estimate. So it's really important to give them good data for those estimates, but they also need us to give them data to show how we're doing as a COC, and it's important for us to look at that data as a COC and individually within our communities to see how we're doing and where we can improve. So when we're submitting to HUD, what we're looking at is the data from our point-in-time counts, data from housing inventories, and then HMIS, Homeless Management Information System. So we report the data separately for individuals and people and families, or households with children. Just so you know, HUD records everything as households without children or households with children. And each one of these categories, it's broken down between emergency shelter, transitional housing, and permanent supportive housing. So that comes out to 8 different categories, or what HUD calls, for the purposes of this report, shells. It's important for us to be able to report as many shells as possible to HUD. And we are working on those reports right now. Those are the shells. Emergency shelter, everything has the emergency shelter, transitional housing, and permanent supportive housing. They're all broken between family and individual shells. It's important for us not only in our planning efforts to look at our annual homeless assessment report, but it's also important because it is a scoring factor in the application for funding that we submit to HUD each year. And the renewal funding and new funding of our projects could be dependent on how well we score on this. So it's important that we do a really good job with this AHAR, because COCs across the nation are doing a very good job in submitting most of their shells. So we need to start doing better and catching up. This report is based on data from October 1st through September 30th. This report is for October 1st, 2014 through September 30th, 2015. Now, I keep saying that we need to submit the shells to receive points for our AHAR. These different categories or shells are submitted, or that we're allowed to submit them, if we have good HMIS bed coverage. So we need to have at least 50% bed coverage for that particular shell. So for emergency shelter family beds, we have to have 50% HMIS bed coverage. Now that excludes domestic violence programs, but 50% of all other programs should be covered by HMIS before HUD will accept it. Then our utilization rate. So if a program has 10 beds, they should be using at least 7 of those, or 6.5 if that's possible, for HUD to even consider them for participation in this report. So we need good HMIS coverage and good bedded utilization by our programs, which we should be having anyway. And then we need to make sure that we have as few missing values as possible, because HUD views data completeness as a good measurement of data quality. So here's where we are this year, and I will tell you that it's not looking good so far. Unfortunately, right now it looks like we only have one for sure shell submission, and that's for permanent supportive housing individuals. Last year, if you are wondering how we did last year we submitted 3 shells. We submitted transitional housing family, permanent supportive housing family, and permanent supportive housing individual. We're still working with HUD on this report. We think, pretty sure that we can get transitional housing family up to the level, the bed utilization level that we need to submit that, but we're going to need your help and information from you if you run a permanent supportive housing family project to get that bed utilization rate up. We sometimes have data in our housing inventory that is not up to date, and we are allowed to update some of that information to improve this report. So we're working on that and trying to get that done before next Wednesday. So if you hear from us on this, please respond quickly, because it will mean points to our COC and could mean funding for our renewal projects or new projects. So I'm sorry to say the AHAR report's not looking great right now, but this should be a wake-up call to us that we need to get to work on this and improve our data quality and HMIS coverage and bed utilization for our programs. So that is a quick update of the annual homeless assessment report. Next, we have an update on the supportive services. Well, actually, let's pause and see if there are any questions. Are there any questions, Craig? Okay. You guys feel free to write in questions. We thrive on your questions, on your input. So Mary asked if I could explain bed utilization rate a little bit more. So in my example of the 10 beds for a program, we have, on average for some of our programs, for example, emergency shelter for families. Across all 100 some odd programs, we may have, let's say, 100 beds. We have a lot more than that. But what that 41% is saying under the bed utilization, and I can't, there we go, under bed utilization, what that is saying is that just a little over 41 people for every 100 beds is, for every 100 beds, only about 41 are filled on any point in time, or in this case, on our point in time count from last year. So that means we have a lot of empty beds out there for this particular project. And if we're having that, and we're having that consistently, we need to look at that as a COC in programs and determine, well, do we need to really have that many beds? Could we make some of those beds transitional housing or permanent supportive housing or something like that? And the numbers look like that is what we have to do, because for the most part, when you look at bed utilization, the percentages are low starting at the top of this chart with emergency shelter, and then the utilization gets higher when you get into transitional and permanent supportive housing. So if we have open beds in emergency shelter, we need to start thinking about how we might use them a little better for our clients and for the community in which these programs are located. Okay, so there's another question about HMI's bed coverage. Okay, so in my example of 100 programs for emergency shelters for families, if you have 100 programs and they each have one bed, 100 beds, if it was 56% HMIS bed coverage, you would have 56 of those beds accounted for in HMIS. So case managers would be entering data for programs that have those 56 beds in HMIS. So if each program only had one bed, 56 of those programs would be using HMIS. Bed utilization rates could be data entry errors. I also think that one of the things that a lot of our programs do when we're looking at updating the housing inventory is that they get a call from Texas Homeless Network, and we ask them, how many beds do you have in your emergency shelter? And what is reported to us isn't always the reality day to day. What's reported to us is what they could do if they absolutely needed to. So we could call up Shelter A, and Shelter A may have 10 beds available at any time that they generally use. But when they get a call from Texas Homeless Network, they say, no, we could house 25 people at any given time. When really that's just the most extreme case. What we need to know at THN is what the regular day-to-day numbers are, because that reflects the accurate inventory and does not inflate our capacity the way I think we are doing. I think we have more questions.
Does utilization rate come strictly from HMIS?
No. Utilization rate comes from the housing inventory report. So when we call you up and we get numbers on the number of emergency shelter beds you have for families and individuals, then at the same time, we also use the point in time number from your program from that night. That is the point in time count of that night. So if you have 20 beds total and 10 of them are full that night, your utilization rate is 50% for that night. Any other questions?
Would it be helpful, does the coalition need to help out offering some sort of training on the importance of these results?
Yes!
I don't think I need to answer that because we're getting a lot of yeses in the room, and that's true. Yeah, it's very important what we have, and we will certainly help you. And don't be afraid to tell us what the reality is. Don't inflate your numbers if that's what's going on. I'm just assuming that might be going on. I see a lot of questions coming in, so I guess you can ask the next one.
Why would we submit transitional family members?
Okay, so Craig, I don't know if that was picked up that well because I have his mic off, but he asked why the transitional housing for families isn't already being submitted. It's because it falls right below in terms of our bed utilization rate threshold. Our threshold for that is 65%. So, but I think there may be a few mistakes with that report, and I think I can get that up to 65. So hopefully we can submit it. Any other questions? And yes, we will come out, or we will have a webinar talking about the importance of this training. We'll have one-on-one TA with you, whatever we need to, because it is very important we get these numbers correct and we improve our data quality. And there was some signs of money flashing, but I'm not sure I can do that. So. Yes, and one more thing, we'll stay on this subject a little bit longer. Pretty soon you will be receiving housing inventory surveys from Lindsay. It's very important for you to fill out those surveys, fill them out correctly and quickly so we can get that data in, we can look at it, and we can address any questions we have with you as soon as possible so we have everything in place for the report we give to HUD, and we're not scrambling at the very end trying to get this all arranged and reported to HUD. So please keep an eye out for that, and please respond to that quickly. And if you're a representative of your community, which I'm assuming most of you are since this is the RPG meeting, please emphasize the importance of that survey to your members. They really need to fill that out, and for those that are funded, those programs that are funded, they have to fill that out correctly. And they need to meet that deadline that Lindsay identifies for them to fill that out. Okay, I think that might be all the questions. So, thank you all for the great feedback. We love that. So, I'm going to go ahead and let Caitlin talk about SSVF. Caitlin and Sophia. I think Sophia is going to start. So, I'm going to go ahead and unmute her and mute myself.
So as I mentioned earlier, in 2016, we're going to focus on ending veteran homelessness in those 6 communities in an effort to inform systems change work that will happen all over the Texas balance of state continuum of care. And during the next year, we'll also be looking at a lot of internal processes and also a lot of the different funding sources and how they play into the goal of ending homelessness. And so SSVF, or supportive services for veteran families, are a huge component of that. So I'm going to pass it over to Caitlin now.
Great, thanks, Sophia. This is Caitlin. I'm the Balance of State Programs Coordinator, and a big part of what I do is coordinating programs. So that's coordinating your program with other programs that are in your area to make sure everyone who needs to be sitting at your table is sitting at it, to make sure that your plans are as comprehensive and tailored to your community as they can be. So as Sophia said, this upcoming year we're going to be doing a big push for ending veteran homelessness. And one of the primary tools that you may have in your community is called supportive services for veteran families. And if I could ask Craig to pull up that map, I can show you what the coverage areas are to see if you might have a SSVF program in your area. So if you can find what county that you're located in, if it is shaded in that sort of bluish aqua color, you have an SSVF grantee in your area. If you would like me to make a contact for you, if you see that you have a coverage area and you've never coordinated with your SSVF folks before, please feel free to give me an email or a call, and I can help you make that connection so that way they are sitting at that planning table with you. SSVF, just a little overview, it is supportive services for veteran families. It is a rapid rehousing and homelessness prevention program that is available to both individual veterans and individual veterans with their families. So a family can be rehoused rapidly as well, or prevented from entering homelessness. It is temporary financial assistance, but it does have a significant service component, and it will help those folks get linked up to other services at the VA. They have some pretty good contacts at the VA as well, so if that is something that you want in your community to be sitting at your planning table with you, please do give me an email and I can help facilitate that connection for you.
Muted.
Okay, thank you, Sophia and Caitlin. Next, we're going to talk about Project Connect workshops. Cameron Fowler is actually going to talk about that. And I will pull up, oh, I'm sorry. Mary Dotson's going to talk about that. And I'm sorry, I got ahead of myself. It is the, we're going to talk about the consolidated application. Mary is going to summarize that right now, and then we'll talk about Project Connect workshops.
As many of you know, we held the Continuum of Care program application process over the past few months, and just wanted to give you the highlights of that, 5 top points. The process that we used in a nutshell was that project applications were submitted to THN. They were scored by an independent review team. We had about 10 reviewers who are organized by one of the consultants that we work with, who did the scoring according to all the materials that we had released. And then each application was ranked by that independent review team and THN staff using the COC approved criteria. And finally, the ranking and all the projects were approved by the COC board for inclusion in our submission of the consolidated application. In total, we had 39 applications that were submitted, 36 for renewal projects, including HMIS, for a total of almost $7.2 million. We had 2 new projects apply for the permanent housing bonus money that HUD made available, and those 2 projects together applied for $2.2 million. We submitted a COC planning project application, and that's a special kind of application that HUD makes available to COC lead agencies to do the work of, help do the work of the COC. And we were very fortunate this year the cap was increased, and so we applied for just over $1 million. So that was a total of 39 applications and $10.4 million. So big application for us, and we were excited to work with all of you on that. The most common types of projects that we applied for were transitional housing and permanent supportive housing. We're going to be looking at those over the next year, hopefully getting more rapid rehousing going in our community, or in our COC. Finally, the COC application itself is another piece that gets submitted. The project applications represent individual projects, but the COC application represents what's happening across the COC. And the questions in that application have to do with some of the things that we've mentioned already. What was our point in time count? How are we doing on HMIS bed coverage? But also goes into things that are more strategic planning and performance oriented. What are our plans for the upcoming year to, for example, reduce the length of time that people remain homeless in our COC? And we are going to be presenting that COC application to the COC members at some point soon. We want to follow up first with project applicants, and Cameron will be talking a little bit more about that. Just to go over what you applied for, how the process worked, and some strategy about what we might do over the upcoming year to be in a really good position for applying next year. And then again, we want to share what the COC application said, and that will also inform in large part, our work plan for 2016, because just like Eric showed you the AHAR data, we have some very specific data points from that COC application where we can look at, as a COC, how are we doing in terms of what HUD's goals for COCs are, in terms of how other COCs across the country are doing, and kind of where do we need to be. And so we've got some areas identified that we're going to be focusing on for the next year to improve our overall COC performance. So in short, we're doing some great work, and we've got more work to do. So I will turn it over to Cameron for some more comments on the next steps in following up on the COC application.
Good afternoon. This is Cameron. We'll actually talk more about the NOFA review in a little while, but I wanted to make all of you aware of some Provider Connect workshops that are coming up. We are working with APT Associates and the Corporation for Supportive Housing as part of our HUD Priority Communities TA, and these workshops are going to just be for grantees, and I think we'll have, oh, there we go. We're going to be doing 2 one-day workshops in February. We'll be in Longview on February 16th, in Denton on February 18th, and our second round of workshops will be in March. We'll be in Corpus Christi on March 28th, Galveston on the 30th, and Beaumont on April 1st. We'll be getting a save the date out to all of our grantees before the end of the week. And as soon as we've got details on where these are going to be held, we'll be letting you all know. We're hoping our grantees in each of these areas will all be in attendance, and we're also hoping some folks may be willing to travel. If some of you have ever attended the HUD startup workshops, well, the ones that they used to do, we're going to be doing a lot of that, but more in depth and with some really great TA providers. So we've got an overview of the topics that are going to be covered, and the first one will be outreach, initial documentation, and intake requirements. So really digging into the documentation required to do an intake and admit clients to your HUD-funded programs, a really thorough review of eligibility determination, and then leasing activities and requirements. We know that stuff can get tricky, so we'll get into that in detail, and also looking at
different types of leases for different types of programs, participant agreements versus occupancy agreements, recipient and subrecipient agreements, and in addition to that, we'll be looking at HQS inspections and rent calculation documentation, rent reasonableness. The third topic will be ongoing occupancy, and that will be focused on working with landlords, how to handle security deposits, doing recertifications, and other special circumstances. And reasonable accommodations as well would be covered under that topic. And the fourth topic will be administration and financial management. So working with your programs to ensure you have a reasonable accommodation policy in place, discrimination policy, termination policy, appeal policy. We'll hit environmental reviews, which I know have reared their ugly heads in programs across the nation last year. So it'll be nice to be able to give you all some focused assistance with those. We'll talk about client files. We'll talk about grant funds and tracking and data collection, program reporting. So fitting a lot into a day, but we're really looking forward to being able to bring you all this kind of assistance to you and your communities in most cases. And I will be at all of those workshops. I'll have someone else from THN with me at each of them as well. That's to be determined. I'm also hoping on our in-between travel days, I may be able to have some time to sit down with our grantees and get to know them and their programs a little bit better. So again, we'll be sending out a save the date for those of you that are grantees, and we'll be getting you the details on this as soon as possible. Those are the Provider Connect workshops.
Muted.
I was just going to say, regarding the Provider Connect workshops, if there is a Provider Connect workshop in your community and you are a COC grantee, you're required to go to this meeting, because these are topics that are very important to the operation of your Continuum of Care grant, and it's very important to the quality of your Continuum of Care grant, and it could result in better outcomes, which will help the COC overall. So this is why we're having these workshops here. If you're not in those communities, Cameron will get information out about inviting, she'll be inviting some of these folks, but we really encourage you to travel to one of these communities if you have a COC grant, so you can participate in this. Okay, so before Cameron gets into plans for 2016, I wanted to point out this report that was sent out early this morning, and this is the report that you received an email from me about. In fact, Cameron and I actually wrote that email together. This is the report from Urban Initiatives on Homelessness and Poverty. Well, this is, it's a brief prepared by Joe Coletti and Sophia Herrera, and it's focusing on the largest continuums of care, largest in terms of point-in-time numbers of people experiencing homelessness. Now, as I said when I received this email this morning, I was waiting in line to get coffee and went, oh, we're in the top 12, and I knew that, so that shouldn't have surprised me. But seeing our name, number 7 right there, in the same group as New York and San Francisco, Philadelphia, those places, it's alarming to see that. We don't want our name to be in that group, not because those aren't fine places, those are great places, but we don't want to have the numbers that would determine that we are in that group. So number 1, we need to reduce this population of people experiencing homelessness to where we fall out of this group. That's what we need to do. But that isn't that surprising, because I knew we were in that group, and that's not even that surprising to HUD, because if you look at the number of people in our continuum of care, and then you look at the number of people per capita, or the number of people for every 10,000 persons in our geographic area, I would guess that we would be number 12 on this list. I would guess that our rate of homelessness is lower than the rest of these folks. It's just that we cover such a large area, and that is the reason for our numbers. Regardless, the numbers are way too high, and we need to get these numbers down. Now that, like I said, was alarming, but then when we looked at, like I said in the email, we looked at how our COC is responding and how other COCs are responding, then it becomes, well, frankly, embarrassing. You look at the total number of projects we have, and we have a low number of projects. That doesn't worry me that much. Of course, I want that number to increase. But the reason that doesn't worry me as much is because a lot of these COCs have been operating for some as many as 10 years longer than we have. So that's really helped them gain the number of projects that they're up to. We do need to improve that. But what they're doing with their projects and what we're doing with our projects, that's, well, could be embarrassing. I mean, that if you're looking at what these projects are doing and how they're eliminating barriers so that they can serve those most in need, and how we aren't in some cases. For example, New York City, 96% of their projects have eliminated barriers. I don't know why that's going out. But 96% of their projects have eliminated barriers so they can serve those people that are most in need. What we're reporting is 76% of our projects are doing that. That's something we can improve right now. We can make sure that our projects are eliminating all barriers so they can serve those folks that are most in need. Now, the projects that have adopted Housing First, we are behind the ball on this, but, and I know we were, but when you look at these other areas and you see our 41% standing up there like a big sore thumb, that is very concerning. And I mean, I hate to use the word, but it's embarrassing, especially if we get calls from these other COCs. So we're going to start working on that with you. We're going to focus on some of the projects we think can be converted to Housing First. We're also going to work with you on eliminating barriers. So we don't have 76%, we have more like 96%. But that is something that Cameron's really focused on doing, and the staff here is focused on doing. So we're going to provide your community support on these efforts, and we're also going to focus on individual agencies and provide support to them. So just keep a heads up on that, and please help us to make these changes in our programs and help us to get off this list. I think it's it's actually pretty important that we receive this report at this time, because we can use this information to use as a guide going forward, and it can help shape our training and TA within the Texas Balance of State so that we remove ourselves from this list, and we aren't shocked when we see a report come out like this in the future. So with that, I am going to hand it. Do you want to add anything to that, Cameron? If you do, I'm going to unmute you. Oh, I'm sorry, there is a question that's come up.
If you're not a grantee but in the area and a member of the LHC, would you be allowed to attend the Project Connect workshops?
The project, so the question was, if you're not a grantee but in the area and part of the LHC, can you attend the Provider Connect workshops? Unfortunately, the answer is no. These workshops are focused specifically on COC grantees. So we're really focusing on those folks. Now, folks from outside of that area who have COC grants, we encourage them to attend. But we are limiting participation in these Connect workshops to COC grantees. Any other questions? Okay, so I'm going to pass it off to Cameron. Okay, go ahead, Cameron.
Just wanted to follow up a little bit on Eric, and also wanted to say I appreciate THN and being here at THN, because the first thing that they did today when we received this brief was send out an email to all of our members, and now we're talking to all of you about it today. starting here when I did at the tail end of the NOFA, that was definitely something that caught my attention, was the lack of housing first and low barrier programs. And we are going to do a lot of work to support you all to make this shift and to implement housing first and really start focusing on best practices and systems change. And that's something you're going to see throughout all of the work that we're doing over the next year. It's going to be, with the Ending Veterans Homelessness Initiative, the work we're doing with SSVF, you're going to see us asking you for a lot more when it comes to your data quality. You're going to see and hear from us about what you can do with your data, how you can use it to make informed decisions on your programming. As Eric said, we're really going to be digging into barriers and helping you all really evaluate your program criteria and eliminate those and serve those that are most vulnerable. So it was a little disheartening to see that this morning, but it's nothing that we didn't know, and I hope it's not a surprise to any of you. And the great thing is there are a lot of enthusiastic people in this room ready to work on this with all of you. We're not going to be able to do it without you. I don't think you will be able to do it without us. One of the things mentioned in Eric's letter was, please don't wait for us to start this work. There are great resources out there. The writing's been on the wall with Housing First. It's not a promising practice anymore. It's a best practice, and we've seen this from HUD year after year. Bonus projects that aren't dedicated to the chronically homeless and aren't Housing First, those are requirements now for projects. So we need to start shifting all of our projects in that direction. We're going to start with our PSH grantees, but we want everyone to be using this model. And we're looking forward to working with you all to really shift the work we're doing in the balance of state and to improve those numbers that we were just looking at a few minutes ago. Way we're going to start to do that this year is a much more in-depth review of the NOFA. So Mary gave you a really kind of brief overview of the application this year, and in January we're going to be reviewing in depth the NOFA and see where we are as a COC. We're going to be doing that with grantees, and others are welcome to join in for that call. It's really going to help us get a temperature on where we are as a COC, what we need to focus on in the coming year. And following that general webinar, we're going to be doing individual calls with all of our projects. We're going to be providing them with their score sheets from the process this year, and also just in-depth analysis on each program. What you're doing well, what your areas for improvement are. There's going to be a very strong focus on Housing First and low barrier, and a really strong focus on data and utilization. So again, you've heard all of these things from us in some capacity today, and they all fit together with kind of the direction that we want to start heading. So we're hoping that call with grantees will be the first of many. I know I want to significantly increase our communication with our grantees, and we're going to need to do that if we're going to really start focusing on the systems change work. We're also right now designing a monitoring plan for our grantees. There's going to be a really strong emphasis on data when it comes to those plans for our projects that are already designated as Housing First. We're going to be doing some fidelity testing with you all, and making sure that you are true to the core components of the model, and if you're not, we're going to help you get there. You're going to be hearing a lot more from our HMIS team, whether you're a grantee or not. If you're in the system, we really need to get our data looking better, and we want to be able to show you guys how you can use the data to inform your program decisions, to get funding, in some cases to maintain funding. But just looking back at what Eric was showing with the AHAR, we've got work to do, but we feel like we have the right team in place to do that. So you're going to be seeing a lot of new systems from us. We'll ask for your grace and patience, and also the enthusiasm that we have, because I know that you guys work really hard. I know this is hard work, but I know that we can do better, and there's no reason for us to be on that list. We're also going to be, and again, all in the same vein, we're going to be working on our written standards and getting policies and procedures together for the COC. We feel like those will really help guide you all to using these best practices and incorporating them in your work. We're going to be developing a COC work plan, again, with a strong focus on data, on housing first, on systems change, and you'll see that through our work with ending veteran homelessness and the work that we're kind of taking a second look at on coordinated entry. So it's going to be a really busy year, but we're all really excited about the direction that we're heading. And I don't know if we have any questions, or Eric, if you have any comments.
Muted.
So there was a question that came in, and the question was asked, are ESG grantees included as, quote, your grantees or grantees within of the Texas Balanced State Continuum of Care? And in terms of the Project Connect workshops, no. What we're talking about is just HUD Continuum of Care programs, Continuum of Care funded programs that are participating in that. In terms of grantees that we work with in the Continuum of Care, of course, emergency solution grant recipients or subrecipients in your case are considered grantees within our COC. Oh, just let me unmute you.
Unmuted.
You all also, for those of you that are ESG recipients, you're going to be hearing a lot more from us regarding collaboration. Again, we can't do the systems change without you all either, and so expect increased communication from us for your grants as well.
Muted.
Okay, so I believe, let me make sure to look at this agenda so I don't miss anything again. But I believe that is everything that we have on our agenda, but we do want to provide time for you to ask any questions of us or make comments, whatever you would like to do. So go ahead and ask your questions. If it's about any one of these topics or something else, we'll try to answer them. And go ahead and type them in. They'll be relayed. If you need us to open up your mic, we will gladly do that. It might be nice for one of you to talk instead of us for a little while. Okay, so any questions so far? Okay, it looks like no one's asked questions so far. If you have any questions, go ahead and ask them. But if you are not interested in asking a question and you need to get back to your day, you can, but wait 1 second while we tell you when our next meetings are. I'm going to pull that up real quick.
Unmuted.
The next RPG meeting. Let me pull up the schedule here. Ooh. It is okay, January, it's getting ready to pop up. January 27th, so it's quite a while before we meet again, but we'll meet January 27th from 2 to 4 p.m. and I believe the week before that will be the board meeting. I can pull that up, or is it 2 weeks? I'm sorry, it's 2 weeks before that will be the COC board meeting. We did have a question that came in. Could the AHAR PowerPoint, could we add it to the handouts tab? And I believe I did add it to the handouts tab. If I didn't, no, actually I didn't. Let me add it to it now and you can pull it down right now if you want, but we'll also email it to you later. Yeah, use that report to emphasize to people in your community that they need to do a really good job of providing HMIS data and quality HMIS data. So, okay, so it's added to there so you can draw it down. If you don't have any other questions now that we've gone through the agenda, you can go ahead and log off. And we just ask you to enjoy your holidays and get back to us, get back with us after the first of the year, and help us with everything that will be having going on, the point-in-time count, housing inventory update, Provider Connect workshops, and all the system change training and technical assistance that we'll be providing. So thank you very much for joining us, and we will talk to you in late January.